Thanks for that introduction and for the welcome. Buongiorno, hello, bonjour, three languages. So just a heads up, I have no financial conflicts of interest with any industry partners, but I have been funded by some government agencies. So just a heads up. Oh, not working. I could also just go and click.
It's just released.
Oh.
Exactly.
It should work now.
No, not yet.
Just to say, we'll also take questions at the end of the presentation. So if anyone has any questions in the room, but also online, do put it in the chat or raise your hand and speak if you like at the end of the presentation. Try now.
No.
Please.
If it's easier, I could just like walk over there and
Because
click.
of the calls. We'll get it to work.
Yeah, whatever's easier. I could tell a joke. So yeah, I got dressed in the dark this morning and I realized that I'm wearing matching blue everything almost. So I look very blue. I'm not sure how funny that is.
Matching is good.
Yeah.
But sometimes I just take anything. So I look completely strange. But today I have similar colors, or like in the same color scheme, which is good.
So you don't look completely strange today.
Yeah, just a little strange. Yeah. I don't want to wake up.
We can edit this. Really clear about that. This is very academic.
Good use of AI. You could AI generate me a nice soup or something.
Over.
Oh, that's good. I got to say some jokes. Okay. So I'll move on to the academic part. So when thinking about recovery from so I do work on mental health and recovery. So when thinking about recovery from mental health problems, we tend to think of what's important as being, no longer having symptoms and going back to work and school. But there are deeper, more existential elements of the recovery process that I think and others think are really important and have been the focus of my work to date over the past 13 or 14 years. And so what I think is really important for recovery is feeling like you matter in the world and you matter in your community, that you have a sense of meaning and purpose, that you're valued and you belong somewhere. So I think these are really core principles or core elements of recovering from a mental health problem. Myself and others have work in the recovery field have noted that the concept of recovery has kind of been neoliberalized, if that's a word. So whenever I think and talk about recovery, I always like to think about how it's embedded within and dependent upon people's access to broader social, economic, and political processes, in addition to these personal and relational elements that are important to support recovery. So I just wanted to preface with that. And so over the past 14 years, I've been doing work looking at how young people transform their lives and communities following a serious mental health challenge. And I'm particularly interested in unpacking those elements of recovery that I highlighted earlier. How these transformations are shaped by personal, social, and community levels of determinants of health and resilience. I'm doing some work now looking at how these transformations and how mental health recovery and mental health are potentially undermined by intergenerational inequities, and I'll get into that later. We're also trying to develop slowly some interventions to support such transformation and address inequities, these intergenerational inequities. And I guess myself and my myself as leader of my group are really interested and focus on upskilling people with lived experience of mental health challenges, and partnering with community organizations, the NHS and third sector organizations to fulfill what we want to do, fulfill our vision. So I'll start off this talk with so I guess I should say this is the first time that I've ever prepared a talk where I've had to not only talk about myself and my academic journey, but also what my students are up to and my broader group has been up to, which is a bit challenging, but I thought I would start with where I started, which was on the topic of post-traumatic growth. So post-traumatic growth refers to the profound, veridical, which means truthful, positive changes that follow an intense struggle with a trauma, an adverse event, a negative event, and it often occurs alongside significant levels of distress. Tedeschi and Calhoun have divided post-traumatic growth into 5 core domains. These include developing a greater appreciation for life, developing greater personal strength following an adversity, developing improved relationships, identifying new life possibilities, and experiencing some spiritual existential growth. But they note that there are other areas of post-traumatic growth that might be relevant for people. So I started my PhD interested in understanding if post-traumatic growth was something that could happen following a first episode of psychosis. So I conducted a study at an early psychosis clinic in Montreal, where people received care for up to 2 years, and they got some case management, some medication, CBT, and that kind of stuff. And to understand post-traumatic growth following the first episode of psychosis, I used something called mixed methods convergent design, which entailed conducting integrated qualitative and quantitative components simultaneously, and then synthesizing the findings to have an overarching understanding of how such growth could potentially occur. And what I found within the qualitative component of that work was that participants described several core areas or core elements of post-traumatic growth. These included experiencing improved health, a stronger sense of self, and improved personality, stronger, more balanced spirituality and religiosity, improved relationships with others, and improved lifestyles, new goals, and expectations for the future. While this was happening, participants also experienced profound declines in difficulties that they also highlighted and were important. For some people that I spoke to in this work, these changes represented fundamental shifts from how they were before. So these changes represented like a kind of like a before and after the psychosis happened. But for other participants, these reflected kind of attempts by them to reconnect with who they were before the psychosis happened, often when they were young children, or attempts by them to kind of solve problems that they felt might have precipitated the psychosis to begin with. I also was curious about what might facilitate post-traumatic growth following psychosis. And this is a little figure showing that from the qualitative component of the study. So yeah, facilitated by a bunch of different processes. The most important one of these was receiving mental health services where participants felt like they were treated like human beings with dignity and respect. Other noteworthy elements that facilitated post-traumatic growth included drawing on their own personal and social strategies or social resources and strategies. So these included things like their own, I guess, social support networks, their kind of like willingness, or not willingness, but like urge or desire to want to grow from the experience. Participants also talked about drawing on broader meaning making or cultural frameworks on the outside to kind of get some inspiration about how they might want to grow. And then for some participants, they highlighted how the growth that they had experienced was not easily disentangled from the normative developmental processes that they were just going through as emerging adults. So I conducted those interviews at one time point. I conducted 12 of them, and I wanted to see how how it looked, how participants continued to change 1 year after those initial interviews. So I was able to recruit 7 participants for some follow-up interviews to kind of understand what had changed, what they felt might have precipitated those changes, and that sort of thing. And so following 1 year, all participants talked about experiencing some new challenges that emerged throughout the year. So some of them talked about experiencing a subsequent episode of psychosis, more trauma, other types of mental health symptoms. In addition to these more symptom-specific challenges, they also talked about experiencing kind of social challenges. So, being dehumanized at work, experiencing discrimination. Participants talked about experiencing new areas of post-traumatic growth or new changes.
Oh yeah, I can't even hear though.
Oh, okay. So the new areas of post-traumatic growth mapped onto what they had experienced during the initial interviews, but what I picked up on during the subsequent interviews was that they described a greater willingness to want to draw on their own lived experience to give back to others. And when I asked them about what had facilitated their post-traumatic growth after that 1 year period, they spoke less about the importance of receiving mental health services and more about the importance of receiving peer support and being embedded within communities more broadly that offer them value and a sense of belonging. So these could or could not have anything to do with mental health. They could be about, art-based communities or just communities in general. So I've spoken about this stuff for a number of years. I've talked to a lot of clinicians about this work, and I tend to get 2 different types of responses. So some clinicians tend to be very enthusiastic about it, and that's great. And then I also get comments from clinicians like it's impossible for someone to experience post-traumatic growth following psychosis because how could that be? So I think there's issues with both types of comments, and I've become a little bit neurotic about this, or maybe not neurotic. Neurotic probably isn't the best word, but I feel like the topic in general has to be handled with a bit of care and further examination into clinician perspective is needed. So I did this little pilot study at the end of my PhD looking at case manager perceptions of post-traumatic growth. And what I found was that case managers endorsed service users' post-traumatic growth much lower than service users themselves, which is not super surprising. But what I did find was that they were least likely to endorse the area of improved spirituality. I think that links pretty well with a lot of research and showing that clinicians are very reluctant to talk and to acknowledge the importance of spirituality within clinical care. I think it was 2 or 3 years ago. No, 2 years. 2 years ago last year. Some colleagues and I put together this perspective piece drawing on all the lessons we had learned on post-traumatic growth, and to give clinicians some guidance on how to support post-traumatic growth within clinical care, just because I feel like this topic is quite sensitive. So the first point we make is that we think gentle encouragement. So if someone's talking about experiencing post-traumatic growth, then clinicians could go with that and run with it, but not make anyone feel like they need to experience post-traumatic growth in order to be like this amazing super client. Being open to different explanatory models, encouraging the use of spiritual and religious resources when appropriate, and facilitating narrative reconstruction. So these all being different strategies that clinicians could think about when they're thinking about supporting post-traumatic growth. I guess following on with this line of work around clinicians and post-traumatic growth, I have a student who's assessing NHS staff awareness of post-traumatic growth following first episode psychosis. So in the earlier study that I showed before, that was based on a pretty small sample size, and you can't really make some good conclusions off of that. So My PhD student Laura is going to be unpacking this across early psychosis services more broadly. She just got ethics, so no results yet on that. I have another cool student, Will, who's looking at the importance of psychological flexibility in post-traumatic growth. It's not really specific to psychosis per se, but yeah, well, again, just got ethics, so no results yet, but he's really interested in seeing if this concept could facilitate post-traumatic growth and then potentially offer some novel insights into what could work within clinical care. Some of the work that I've done on post-traumatic growth, Dublin, the Arches Recovery College, and based on that, some colleagues and I are thinking about co-producing recovery post-traumatic growth courses with recovery colleges in the UK, and that's something that we're developing for a grant application. We'll submit in the summer. And the idea is that it'd be a great place for people with lived experience as well as staff and others to get some knowledge on post-traumatic growth. Based off of what people at the Arches Recovery College has said, it's been really important in helping clients feel like their lives aren't completely broken and that there's something that could follow from what they've experienced. So we had a conversation about video games earlier, so I'm a big video game player. This isn't directly connected to post-traumatic growth, but a master's student and I are doing something called a visual discourse analysis of 2 video games. And we're unpacking the messages around how people could make meaning from the experience of chronic illness as depicted in video games, because I think, well, we both think that video games could tell us a lot about how to negotiate with struggles. And these are 2 very popular video games that I've spent hundreds of hours playing. They both contain these types of narratives, and they're really, really interesting on that front. Master student is in the process of finishing up his dissertation, so no results yet. But yeah, looking forward to sharing that when that's all done and dusted. So I'll move on to the next phase of my work, which is on generativity. And I'll have to like loop back a bit, and I'm sorry if this is confusing. But so my PhD work highlighted the importance of peer support and community and facilitating post-traumatic growth following psychosis. So during my postdoc, I was curious to see if people who received sorry, I'll backtrack again. So, and people talked about wanting to draw on their experiences of mental health to give back to others at the second interview. And then they talked about how peer support and being part of community was important in that. So I wanted to do some research unpacking that a little bit further. And so the concept of generativity is one that matches onto those experiences. It's a multidimensional construct that refers to one's concerns for and contributions towards the betterment of other people. And it could be expressed in a variety of ways, such as through caregiving, mentoring, teaching, engaging in civics or advocacy. It was developed by Eric Erickson to represent one of the final, or not the final, one of the middle-aged stages of a person's development. So the first phase of that postdoctoral work was to conduct a scoping review to determine what the state of knowledge was on generativity and peer support among people with lived experience of mental health challenges. What I found was that there were only 3 articles that directly addressed that, highlighting an important knowledge gap in the field that I wanted to address. And I addressed that using an empirical mixed method study. Sorry. So what I did was I conducted a quantitative component where I gave people some questionnaires measuring generativity, the receipt of peer support and recovery. And then I conducted a qualitative phase where I asked people to interpret the quantitative results and then also elaborate on what on their own experiences. I conducted this study in the US at a community mental health hospital serving in the public sector. And then the COVID happened, so I couldn't complete the qualitative phase there. But I recruited peer support workers working for community organizations in the state I was working in, as well as people on electronic listservs. And what I found, so I gave people a questionnaire measuring different types of generative acts that they could engage, that potentially they engaged in. And overall, lots of generative acts endorsed, ranging from, listening to people tell me about his or her personal problems to things like doing something others considered unique and important. When I asked participants in the qualitative phase about their own generative, how they engage in generativity, they broke down their generative acts into two different categories. These were being kind to strangers on the street. And then participants also talked about the importance of engaging in more concrete or behavioral acts of generativity, such as engaging in civil disobedience, organizing conferences, becoming mental health advocates, that sort of thing. When I analyzed the data to see if receiving peer support had an impact on generative acts, I didn't find a significant difference, but might be because the numbers are small. Again, this was all interrupted by COVID, so I really don't know. I mean, based off this data, it doesn't look like there's an impact, but the direction of the bars is in the right, the right direction, showing that maybe peer support could foster a sense of generativity or generative actions among people. When I spoke to the participants in the qualitative component, they gave me some really cool insights about why I also didn't find significant results. And they felt it was because the participants that I recruited in the quantitative component were delivering peer support within a hospital-based setting where they felt they weren't actually giving peer support. They were just doing things like helping people with their medication, adherence regimens, or doing the work of clinicians, and not really engaging in that type of peer support that's revolves around relationality and yeah, that kind of thing, things that actually matters with peer support. So maybe I'll do a future study looking at that in more depth. I looked at the relationship between engaging in generativity and personal recovery. I found that there were some correlations or associations between personal recovery and generativity, in particular across these three subdomains of personal recovery. But then when I spoke to people about the link between generativity and their recovery, they really highlighted how, engaging in generative acts was essentially the most important thing as part of their recovery. And this is my favorite quote from a participant reflecting that. How my meaning in life is giving back because I was giving it so freely. I definitely went through a lot to earn my seat, but at the same time, I don't want to just say, hey, I'm good now and I can move on with my life and not help anybody else. Because what I've been given, I want to make it a career to give them the same thing that I've been given, and hopefully they can do the same thing for someone else someday. I didn't include this other quote from a participant that I like to give during presentations, but this other participant talked about how engaging in generative acts completely transformed them in a way that they didn't think was possible. Really highlighting the significance and power of it for participants in this study. So kind of riffing off of this work, another PhD student is looking at not generativity, but engagement in self-compassion and compassionate acts towards others among young people diagnosed with UPD or BPD. And she's looking specifically at experiences of stigma and social exclusion, and maybe disempowering people from being self-compassionate with themselves or towards others. And no results yet, ongoing. So another spin-off from all this work highlighting the importance of community and community engagement and community for mental health recovery. I won a small grant maybe a year ago to help kind of map all the community organizations in Birmingham supporting mental health for young people. And I've been using that map and that exercise to kind of build relationships with community organizations with the hope that we could yeah, try and make communities a better place for young people with mental health challenges. And this brings me to the third part of the talk, and I realize this is a quicker presentation than maybe I had planned. So the third part of this talk is on citizenship and intergenerational injustice. So after I'd completed all that work on generativity, you know, still a postdoc, and I was applying for more funding and talking to more people with experience about, you know, based on what I've done so far, what do you think I should be doing going forward? And they were talking about the importance of this concept of citizenship and social belonging. So as expressed by this person who I spoke to, people with mental illnesses are often unable to progress within social systems, in part because our unique contributions to society are not valued. And to facilitate recovery, it's essential that we examine these more structural barriers that prevent flourishing and are embedded within this experience of citizenship. So I tried to embark on some work on citizenship. So there's this popular or the most well-known model of citizenship that's been developed in the context of mental health is the one proposed by Michael Rowe in the States. And he defined citizenship as the extent to which people have access to these 5 R's of citizenship, which represent persons' rights, such as the right to vote, resources. You could think of resources as key social determinants of health that we know about, like having a home, income, having valuable roles such as being a student or an employee, having responsibilities such as taking care of other people, and having relationships with others that foster a sense of belonging. There's been some debate within the citizenship literature, or maybe some ambiguity as to how this relates to recovery. And the way I see it is, we need to have all these to fully recover. That's the way that I kind of take it. Another important point from the citizenship framework is that being able to contribute to one's community is important, but then also being able to have those contributions be reciprocally valued and seen as meaningful is also very important within this model. So COVID happened, couldn't recruit participants, so I had a lot of time on my hands. So my colleagues and I wrote a perspective piece on how we might think about fostering or supporting citizenship-based care for young people. And we highlighted four connected ways of doing that. The first being to deal with disparities, so disparities among racialized groups, let's say. Fostering better links with third sector and community organizations, embedding community connectors within mental health services to help connect young people with broader communities, and then also addressing social determinants of health. And this takes me to this project that I've been working on for a while now on intergenerational injustice. So there's this work, there's a lot of policy work, there's a lot of talk in the media now about how the social and economic conditions for young people are much worse than they are now than they have been for previous generations. And this is, you know, we see this in the news quite often now, but, you know, housing has become very unaffordable for a lot of young people. Work is no longer as stable as it used to be. We're seeing poor wage growth. all that. And so I think it was in the summer, the Lancet Commission on Youth Mental Health published a paper highlighting that we need to look at the influence of these determinants of health on young people because they're growing in importance. And myself and some master's students published something to that effect as well. So since the publication of that, my research assistants and I have been conducting qualitative work with young people in the UK, looking at experiences of intergenerational injustice and how they might impact their young people's sense of belonging and their mental health. For this study, I believe we recruited 18 young people so far. We recruited them through social media, electronic listservs, community organizations, and I'll go through the results of what we found so far. So the first, when talking to participants, the first thing that they highlighted was the sense that they felt abandoned politically. So they felt that in the UK, governments are no longer interested in supporting the needs of young people. They're interested in supporting the needs of older generations, and participants talked about how this has led to significant levels of despair. And this is a quote from one participant highlighting that. I just feel like, so what's this country doing for me? Because I do my part, I pay my taxes, I don't do anything illegal, and yet I'm just sort of like, there's nothing. I can't really do anything. If I sort of, the money help, if I go to sort of the money help advisors or job center or whatever, they just like, there's nothing they could do. I apply for extra benefits, but I'm not eligible. I'm kind of like too rich to be poor, but not rich enough to be rich, if that makes sense. Participants talked about how their feelings, how they felt that as a result of political abandonment for young people in the UK, this has led to greater precarity around young people's means to support their lives. So participants talked about experiences of precarity around housing, about wage growth being stagnant, about the cost of living crisis, about experiencing a lot of climate-related distress, as being particularly important. And this participant expresses that really nicely. Now my husband's working and my husband is earning more than my dad, like possibly 2-3 times more than my dad, and we still can't afford the basic necessities. First of all, I'm in social housing and I've got a master's in clinical psychology. I've got a job and I can't even afford to sort of go private renting, even if me and my husband are both working. So this sense of or this greater precarity around the means to support young people's existence and potential has led participants to feel like they had diminished opportunities to live a full, healthy, meaningful life. So they talked about how they and others in their generation are suffering from greater mental health problems than previous generations. They talked about how they felt that their own personal development as emerging adults had become stunted because they couldn't meet the milestones expected of them that were important for their parents' generation. They also talked about no longer having the same quality of physical health as previous generations because a lot of them couldn't afford food that their parents were able to afford. Yeah, this was a major issue. They also talked about and this is a quote highlighting the mental health strain caused by such precarity. So everyone wants you to look good, everyone wants you to try to meet society's standard, and you're struggling with your saving, you're struggling with your bills, you're struggling with everything. I think pretty much my financial situation is actually kind of not stable, because you're competing to, meet up the standard of society, and you're also competing to stay on course compared to my parents' time, which wasn't the level of competition during their time wasn't that much of a problem compared to our time, our generation. So really this perception that there are these generational differences in both the means to support one's mental health and also with regards to one's mental health. Another result of this greater precarity that young people described experiencing was the sense that their social and cultural life has become eroded. So participants talked about how society and culture more broadly in the UK had become centered around like hustle culture, overly sexualized, very individualized. It's all about you, and you know you need to like make it big or you're nothing. A lot of participants of color that I spoke to talked about how experiences of discrimination had gotten worse over time, and they felt like they were experiencing greater levels of discrimination than their parents' generations, coupled with a sense that society and people weren't standing up to them as much as their parents' generation. Some first and second generation immigrants also talked about how they had lost some of their cultural cultural practices over time as a result of their parents coming over and then losing touch of that. And here's a quote showing what this kind of looks like. Yeah, I think for me it has to do with, should I say, not just a generational thing, but a historical thing, you know, that has to do with discrimination, that has to do with hate speech, that has to do with deprivation, you know, from held housing, treatment in the society, you know, within the Black communities, white supremacy and stuff like that. So I feel that it has to do with the historical entity that drives a lot of minds that go crazy in terms of the way people have been treated, you know, people of color, people of, you know, minorities and the rest. So yeah, that's how I see it. And reading this quote kind of makes me aware that there's this intersection between pre-existing hierarchies, structural issues, and intergenerational issues that might be happening at the same time. And finally, participants talked about how technology and social media was kind of like extra fuel to the fire on all this. So social media was seen to make mental health worse for all young people in the sample. Participants felt like engaging in social media throughout their lives made participants feel like they were less connected to their friends and others compared to their parents' generation. And this was evident throughout all these themes. So in addition to this study, I have some undergraduate students who have just completed their project looking at different elements of these intergenerational inequities that I'm interested in. One student has been looking at how the cost of living crisis has led to some young people feel like they're no longer proud to be British. So it's resulting in the sense that, you know, they're not happy to be British anymore. That it might be driving political polarization among young people, at least within online, as a result of online spaces. And that the cost of living crisis has had a negative impact on student mental health more broadly. Despite all this, and you know, there are other studies coming on this. These are just two little stories that I've picked up on in the media today. So Reeves condemns rise in unemployed in education or trading youth as a stain on our country. You know, surge in young people admitted to hospital in England over mental health. Well, yeah, no surprise there. And I think I think Reeves's comment is a stain and not the fact that young people are struggling so much. So I'll end there, and I want to thank my most immediate people in my network. These are members of my group. So my PhD students, master's students, undergrads, some key collaborators, and my amazing research assistants who've been helping me. And with that, thanks, and glad to take any questions.